Hello, everyone, and welcome to Gray Anatomy. It's a beautiful November day, and we are going to hear about a new program at LMH Health. It's Upright You, and I was thinking Upright You like me, but it's Upright University. So this is a new program started by two physical therapists there, and Lynette will be with us later. She's working with a class right now. Let me go back a little bit. But we have Katie Poff with us, and she is going to get our party started and tell us a little bit about the program. And I want to be always sure to thank the Katzmans for their support with their foundation and also Cap Federal for keeping the lights on and the knowledge flowing through the airwaves on our Zooms when we do Gray Anatomy. There's quite a few of us signed up today, so if you would mute yourself if you haven't already, and if you have a question as Katie's going along, please put it in the chat box and I will bring it to her attention. There's also going to be time at the end of the presentation to ask questions. So we want to make sure we get all your questions answered. So we're going to get started here and I'll turn it over to Katie. And thanks for being with us today. And we're very curious to hear about Upright You. Tell us
Yes.
all about it.
Yeah. So yes, I'm Katie Poff. I'm a certified physical therapist assistant at LMH Health. I work with Lynette on the fourth floor. We mainly work with inpatient rehab patients. And then we also are the kind of we're two of the three founders of the Upright U class here at that we teach at Rock Chalk. So Lynette is the primary teacher. I kind of substitute when need be, and then Stacia Bone is a physical therapist that helped us to kind of create, and she'll also jump in and help teach some of the classes as well. So today we have set up a fall prevention PowerPoint for you that we're going to go through just some things here. And then Lynette will be joining us here soon after Upright University is over. And she will talk to you a little bit more about exercise programs and then the Upright University class and how you can start participating in that. So, um, first thing here, let's see if I can get on it. There we go.
Actually,
So
this for me.
big thing about this is what is a fall? So fall prevention is the biggest thing. So just recognizing, what is an actual fall? Technically, it's landing on the ground or some other surface when you didn't intend to be there. Includes slips and trips. It also includes things like, you were just squatting in the garden and you happen to lose your balance and fall back a little bit. And if you were on the toilet and had to reach over and grab the toilet paper and you just happen to slide off of that. Those are things that sometimes people don't think are actually falls, but that is something that we still classify it as. Can be with or without injury. So I'm sure you guys know there's some falls that you just hop right up and act like nothing happened, but it is still considered a fall in the therapy world. Just a few statistics for you. We've got 25% of adults 65 and older fall each year. So 1 in 4 adults are at least reporting that they have fallen. 95% of hip fractures are caused by falls. I'm sure that you guys know it would probably be pretty difficult to, fracture a hip without an actual fall happening, but the result of that can be pretty detrimental to people. Every 11 seconds, an older adult is treated in the ER for a fall. It's something where, we're looking at the emergency room board and fall is on there typically, 3 to 4 times at least. It's also the leading cause of injury and death for seniors. So, like I was saying, falls can be very simple. You just topple over and you're fine, but there can be some significant injuries that happen and, things like internal bleeding or head injuries. They can lead to some significant issues later on or even death. There's definitely lots of risks that go into, adding to that factor, the risk of a fall. Some of those factors are physical risk factors. So these are changes in your body that increase your fall risk. This can be something as simple as, now you've stubbed your toe, you have an injured toe, and it kind of challenges your balance a little bit more. It can even be things like osteoporosis. As we grow, as we age, our body gets a little bit weaker, our muscles get weaker, our bones get weaker. Those can become a factor for, risking or risk, excuse me, for your falls. Behavioral risk factors. These are things that we do or we don't do that can increase your fall risk. I have a lot of people who, they're walking down the hall in their home and they're just kind of reaching out for the couch or they're reaching out for the chair and what we'd call furniture surfing. And if they weren't using those, then they could potentially fall. So maybe it would be time for like an assisted device. Are you not using something when you should be? Things like drugs and alcohol. People don't think about it, but just a couple of drinks here and there, that can definitely play a big factor in whether or not you are getting from one room to the other safely. Medications are a big thing with that too. So, environmental risk factors, there's lots of hazards in the home. There are things like clutter on the floor, throw rugs, pets, unfortunately. Pets can be a big one that you don't realize can be a cause for falls. In the community, you got to think about things like weather. What kind of weather is it outside? Do I need to wear my snow boots or can I, get from one place to another in my flip-flops safely? Those things are all things to consider. So with all those risk factors, there are things that you can control. Your physical and activity is a big one. Making sure that you are staying active, that is the best way to maintain your strength and your balance and your overall endurance. Your home environment, if you do have those pets that like to jump up on you, try to make sure that they're maybe in another room while you're leaving the house and coming in. That way you can kind of get situated before they're coming out and jumping on you and greeting you. Vision's a big one, that can play a big factor with when you're walking and moving around in the community or even at home. So you want to make sure that you're getting that checked. Medication use, are we using the right meds? Are we getting medication for things that we need? Blood pressure issues, things like that. Can we get a medication to help control that to help prevent falls? Fear of falling, social isolation, those things can definitely happen, especially after a fall. A lot of people, once they've had a fall, it's really hard to get back into it because they're terrified it's going to happen again. So working on that and trying to, work through it by increasing your activity and doing the things that you can do more frequently, that can help you to kind of overcome that fear. Weakness that goes in with that physical inactivity. We definitely want to make sure that we're, staying as strong as possible. And then improper use or just a lack of assisted device, kind of like what I was talking about with the furniture surfing. Is it time to use one? Or have you been using a cane and maybe now we need to look at a walker or a walker and maybe we should be considering a wheelchair for mobility? Things like that to consider. Risk factors that you can't control, unfortunately. Age is a big one. The higher in age you get, the higher of your risk for falls. It is what it is there. When you are over the age of 65, so 65 to 74, your increase or your percentage increases to 26.7%, 29.8% when you're 75 to 84. And then after 85, it jumps up pretty high to 36.5% of a risk for you to fall. And that's in a year. So it definitely increases as you age. And lots of those factors that we were talking about with, osteoporosis, things like that can, weakness and inactivity can add to that. Gender is another one. Women are at a higher risk for falling and during those falls becoming injured. So osteoporosis, again, I feel like I've said it a lot now, but it is a big one with women because it's a higher prevalence in women. And so then you're looking at the potential for injury to be higher with that. Um, and I've talked to a lot of women about this, a lot of my patients about this, and some of them just say, it's because we're the ones that are up doing it every time. So they tend to, be the ones reaching up for those high plates on the shelf, or, picking up all the laundry on the floor, getting all the things done. So that could be one of the things that are adding to why women are at a higher risk. Um, Medical diagnoses. These are things that you can't control. So, any kind of impaired muscular skeletal function, things like a stroke, or if you have had a fracture or something that's impairing your ability to walk, osteoporosis, cardiac arrhythmias, blood pressure. Blood pressure is a big one, especially as you start to get a little older. You might have something called orthostatic hypotension that happens when you are changing positions. So if you're laying down and you go to sit up, you might start to feel a little dizzy because your blood pressure drops. Sitting up to standing, same thing. Your dizziness and your lightheadedness can happen. Sometimes you even pass out from that. So with those things, we always just recommend people are standing up. You're waiting your 30 seconds to a minute before you start walking. Make sure that you're feeling okay. Alzheimer's and Parkinson's disease, those are a couple of things that really they kind of start to limit your mobility in your body. So with Parkinson's disease, especially, you're looking at what we call a shuffling gait. Your feet are walking really close to each other. You don't have such a wide base of support when you're walking and when you're standing. So your ability to reach out for things is limited. So if you were to start to fall over, you don't have the ability to reach out and grab to make sure you don't tip and fall all the way down, and your base of support is a lot smaller. Um, Cancer, neurological conditions, urinary dysfunction is a big one. A lot of people don't realize it's not just there's dysfunction there, but now it's I'm having to wake up 3 and 4 times in the middle of the night. And anybody at any age, if you're having to wake up that often in the middle of the night, that can cause an increased risk for falls. You're looking at, just being disoriented from being tired. The lights are off, so your vision is not as clear as it should be. And then you have that urgency of I need to get to the bathroom before I have an accident. Even with accidents, there's potential for fluid on the floor, and so you might have a bigger slip risk with that. Um, so just a couple ways that you can prevent falls. Exercise to improve your strength and balance. Um, that's a given. We'll talk a little bit more about that too. Having your doctor or pharmacist review your medications. So kind of like I was saying back there, you want to make sure that if you have any of those like orthostatic hypotension or cardiac problems, that you're taking the correct medications for that, and also making sure that there's not any weird interactions with those meds. Having your vision checked, and then making your home and your environment safer. So those are all ways that you can kind of help to prevent falls on your own. A home safety evaluation is available. There's ways that you can kind of just do it on your own. You can just kind of look around, what's on the floor that I can get picked up? What can I do to, make a pathway to the bathroom a little bit easier or shorter if possible? The CDC has a toolkit there through their STEADY program, and I have a link to that a little later on in the PowerPoint here. But that's something that will help you to identify things in your home, and kind of give you a checklist of, you know, are things within a certain reach in the cabinets? Can I reach everything in the kitchen? Are things up off the floor? Laundry, is it in a way that I can, reach and move and transfer over safely without having to, you know, walk behind me or something like that? There's also a home visit with a home health agency. VNA is a home health agency here in town that offers or occupational therapist to come out to your house, and she will basically just front door to the back of the house and all throughout, what can we do to make things safer? Do you need grab bars next to the toilet or in the shower? Do you need a toilet riser? Should we, make a path like this, in between your couch and your chair so that you can access things a little easier? Moving things in the kitchen, she just basically goes in and says, pick up those throw rugs, and what can we do to make this house a lot safer for you? Um, Assisted devices, that's another way that you can kind of make things a little bit safer for you. We have so many different assisted devices that are available. Walkers, canes, wheelchairs, it's all kind of a matter of, what feels good for you. But I even think it would be a good idea to start in with some physical therapy to see if they can help you to make that decision. So most common, excuse me, are the walkers over here on the left side of your screen. The first one there is a standard walker. So you'll see it has four kind of posts on each. It doesn't have wheels to roll. That one's not my favorite because it does require you to pick it up and set it down, but it does give you the most support when you're just standing still. So that can be really beneficial. The one to the right of it has wheels on the front and then the posts on the back. That's usually our go-to for what we recommend with patients to kind of start out with. And well, not always the go-to, but it can be. But it allows you to have a little bit more stability with standing still. It's not going to roll away from you. And then it has the wheels on the front, so you can not have to pick it up. You can just kind of push it along as you're walking, and it gives you that support. The Hemi Walker underneath there, it's meant for people who maybe would have a stroke or for some reason couldn't use one side of their body. So it would give you that same kind of support that a standard walker would, but it's just for one arm. So they're a little less common. On the right side of the screen there, you'll see your rollators. On the kind of middle left one, you'll see the four-wheeled walker. That's a very common walker that people use. It can have so many great benefits. It's got a seat on it that you can sit down and rest on, especially if you're going on long walks. It has brakes on it. So hopefully, if they're working well, then you can lock those brakes, turn it around, have a seat, or turn around and have a seat and kind of give yourself that rest break that's needed. It can move a little fast, but with that, if you're safe, it's a good thing to help you to kind of stay moving and keep you upright. The three-wheeled walker next to it is similar to the four-wheeled walker, but what I like about these is they're a little bit smaller and you can collapse them a little bit easier. So if you needed to get into a bathroom or you have a really tight hallway that you just kind of can't get around with one of those big walkers, the three-wheeled walker can be pretty handy. Some of those come with seats in them. Some of them just have a basket. There's so many fun options with that. The one underneath the rollators there, that is called a U-step walker. That walker is specific for Parkinson's patients. It can be really beneficial because it has a clicker on it and a line. So with Parkinson's, you kind of have to have, well, it helps when you're walking to have some rhythm to go with your walking and also a visual cue for how to take bigger steps. That walker can provide those. It also has brakes at rest, and you have to kind of unlock it in order to make it move versus the rollator where you have to lock it to make it stop. So it it can be really good for patients in that Parkinson's group. Um, Canes are another option. We have so many different options of canes. The single point cane is where we'll start on the left there. That one is great for people who are just needing a little bit of extra support as they're walking. Overall, they're pretty steady, but, during turning or when they're standing still, maybe they just need a little bit of support. The one next to it is called a hurricane. This one is one of my personal favorites because it gives you support like a single point cane, but it also has a small base on the bottom so that it can hold itself up. And it kind of allows you to move left, right, and wherever as you're walking. So it still gives you just a little bit more of a support there. With the single point canes, it's something where if it's you don't have like a hook for it to hold on to, then you have to kind of let it lean up against you, find a place to, leave it while you're resting or whatever, and make sure it's still available for you when you go to stand up. The quad cane is next to the Hurricane. That one has a small base quad cane, and there's also a wide base quad cane. It would be a little bit more supportive, so it's just kind of a little bit higher up than a Hurricane. So people like to use these on stairs because it gives you a little bit more support when you're going up and down. But also just if you're needing a little bit more support as you're going, this would be the better option. Then I also wanted to throw in a couple of walking sticks there. I don't have anything to do with Trekology, so I'm sorry that that has a brand name on it. I should have blurred that out. I just wanted to show you guys a good example of what walking sticks can do. I have a lot of people who really love using the walking sticks. They think that it really gives them, the ability just to walk normally. They don't have to worry about one thing on one side, but they can kind of use that normal reciprocal gait pattern that we would call it. And they just have that upper support. So finding what works best for you with the walking, like I said, physical therapists can help with that. Or physical therapy can help with that. And also maybe your primary care physician would be a good option too. So if you feel like you need a device, that would be something to look into.
Katie, there's a couple of questions on this subject.
Oh,
The first,
sure.
the first one is arms higher up on the walker. What do you think?
With arms higher up on the walker. Let me see. Do you mean the four-wheeled walker on the rollator?
I I'm not sure. Just says
Yes.
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 Okay. So it can be beneficial to have your arms a little higher up. I have a lot of people who use those to try to keep themselves upright a little bit. It if it doesn't wear out your arms, that's okay. When your arms are up too high and you're kind of at more of like this angle, they can get tired a lot faster. So then it's not, are my legs going to give out? It's my arms can't handle this anymore. And the four-wheeled walkers, they should still work so that you can be closer to them to keep your arms down a little bit lower, closer to your waist, and be able to keep your body upright. A lot of people with the four-wheeled walkers or the rollators, they start using them and they get a little further in front of the body. And so then they're ending up kind of in this hunched over position and they're going like that. And at that point, the arms being up higher, that won't do much good or it won't make a difference at all. The trick is just keeping that walker closer to you so that you're doing that, so that you're able to keep yourself kind of there. Lynette. Lynette just joined us, everybody, so she'll be here.
Okay.
We're talking about walkers right now. Does that kind of answer your question a little bit about whether or not the arms should be up higher?
Yes. Thanks.
Okay, yeah.
And
And
here's
then
a
what was the
question
other question?
also about, oh, I'm sorry, Carol, did you have more to ask?
No, that's great. Thank you.
Okay.
Yeah.
Someone asked, what do you think of canes that have a seat on them?
Oh my gosh, I just saw one of those recently and they're amazing.
A cane with a seat?
Yes. Yes.
I know
So
that same one.
it was the cutest one too. It had leopard print all over it. It can be really nice. As long as that seat isn't getting in your way, but I definitely think that those would be something that is because it kind of has a little stick out on it. Yes, just like
Yeah.
that. And so as long as it's not too bulky for you, not too heavy for you, because I do think it had a little more weight on it, but I don't think it's a bad idea at all. I definitely think if you're in physical therapy, take that into therapy with you and just have them evaluate it and make sure that they think it's appropriate for you at that point. But no, I think that that is totally something that is a brilliant invention. I like it.
I wonder how heavy they are. I mean,
The one that I felt, it was
Yeah.
definitely heavier than a single point cane,
uh-huh.
but it wasn't like, oh my gosh, this is too much to pick up and move. But
Yeah.
it was heavier. So you just have to kind
Okay.
of evaluate what works best for you.
And as far
Does
as
that answer that?
trekking poles go, I have some, and I like to use them when I'm really on a long walk or a hike. Uh,
Yeah.
they make me feel a lot more steady, so I really think they're great.
Yes, we have a couple of people in the Upright U class that use them, and they are wonderful. They're
Oh,
wonderful. Okay, so the next one is just wheelchairs. This is something that we have a wheelchair eval at the hospital for if it's something that you're needing inside the house. You can contact your primary care physician and they can order you a wheelchair eval and have it done at the hospital. They have standard wheelchairs there on the left, and then there's that fancy power scooter on the right. This is going to be one of those things where if you're just getting really tired and you need to do a little bit or more like grocery shopping or something like that, you could use one of those scooters. But if you're needing like an actual wheelchair to get around, that might be something that an eval is necessary for. Let's see here. So health and vision checks, same thing, check your vision regularly for any changing prescriptions or any new diagnoses like cataracts or macular degeneration. Those kinds of things can happen even if you're not wearing glasses. So if you're not, seeing a ophthalmologist or an optometrist every year, then they may not be able to recognize that in time. We do have low vision therapy available at LMH, and we'll talk a little bit more about that here in a second. But medications, we've kind of touched on this a little bit, but anything needed for health issues like blood pressure, cardiac problems, or any other chronic conditions like multiple sclerosis, things like that can change. And so making sure that you're staying on top of that with your doctor and making sure that there aren't going to be any weird interactions with other medications. This is the information about the low vision therapy program. So this is something for anybody with glaucoma, macular degeneration, diabetic retinopathy, visual deficits from a stroke. This is something that maybe like a surgery can't necessarily fix or glasses don't necessarily fix. You can actually go in and have therapy and they can work with you on making things a little bit easier for you to read or see. So there are ways that you can kind of add a little something over your glasses, or you can change lighting to make things easier. But they do a really good job there in allowing you to kind of make progress in that way. Medication review, again, sorry, we kind of talked a little bit about this, but just wanted to add in that, some medications on their own can cause dizziness or cause some blood pressure issues. So when you stand up, you might start to feel a little lightheaded. Other side effects, that dizziness, passing out, things like that can happen. So you want to make sure that you're always talking to your doctor or even the pharmacist to see what things you need to be on the lookout for. Using one pharmacy also really helps to make sure that you're always talking to the same people about it and they know all the medications that you're on. One thing to keep noted or to note is that keeping your medications in a pill box organizer is really beneficial. It's really easy for people to forget, oh, did I take my pill this morning? Do I need to take, two of them today? Is this the right one? And not having that right there in your hands can make it a little bit difficult. So, having pillbox organizers are really beneficial, and then keeping them in a cool, dry space. Bathrooms can be very humid, they can be hot, they can be cold, they can, change temperatures too easily, which can negatively impact medications. So you want to make sure that you are, keeping those safe. I'm going to let Lynette take over a little bit here during the exercise part of this, so she can tell you a little bit more about that, and then we'll talk too about the Upright University classes as well.
Yeah, so I'm a PT assistant as well, and Katie and I work together on the fourth floor. So yeah, part of my job is working on the fourth floor 3 days a week. And the other 2 of the afternoons, I come out here to Rock Chalk, and since last, has it been May?
I was like, I couldn't remember if it was June, July, May. Maybe
Yeah,
it
so
was.
this past summer, yeah, and this is a brand new class. We've had Parkinson's classes, we've had Tai Chi classes, but falling is the number one reason why people 65 and over come to the emergency room, So it's the hospital and my boss came to Katie and I and said, if there's something we can do for the community to help prevent these falls, prevent some of these admissions from falls. So we started this class. Katie, Stacia, and I kind of for several weeks talked about it. We started with two classes. We've just started a third. So we have a level one and two level two classes. We just do some overall strengthening, some upper body strengthening, lower body strengthening. We kind of start with the warm up. Oops, sorry.
Nope, you're good.
And then the last probably 20 minutes of class, we do some more dynamic balance. So I try to change it up. I try to have fun. We have different, whether it's throwing, darts or balls or bean bags. Sometimes I have people pair up and do some different things. We do some dynamic gait training, where maybe they have to step out and in of certain boxes or squares. Anything that helps them kind of change their position, change their body, anything we can do to help them kind of train their brain to know how to correct itself. So when you are at home and say you're reaching for something out of the cupboard or you're turning to get something out of the car, maybe something in here that you've done helps that brain kind of like, okay, I need to acclimate myself. I've done this before. It's a lot of patterning. It's a lot of just training, and we have to take people out of their comfort zone a little bit when we do some balance training. So we have a couple of KU volunteers. We also have a rehab aide that so when I do break out into groups, we have some supervision. So yeah, and then starting in January, just because we've had more participants each session, we're going to have 4 classes starting in January. So yeah, but definitely, this is a community class. We have a general idea, or, we don't ask a whole health history of what your conditions are. So, Katie and I have been talking about maybe doing a little bit of a screening process just because everyone has different kinds of balance issues. And it's interesting to me because I've been doing this for a while, and whether it's vestibular, I think we talked about whether it's poor vision, poor hearing, you've got neuropathy, you can't really feel your feet. Some men, particularly men, are very tight. They have very tight hamstrings. That can affect your balance. So it's interesting to me doing these classes how some people just breeze through a certain activity and others struggle. It just kind of depends on what their issues are. So it's been challenging for me because I'm used to one-on-one therapy to do it in a group setting. But, I always tell people, I don't care how many beanbags you get in the bucket. This is all about just getting out of your comfort zone a little bit. Just try it. I'm not grading you on perfection. I think, since the classes have grown, people have gotten to be friends.
Yeah.
It always helps to have someone to hold you accountable, right? Having you come. So, yeah. So, I do have everyone tell me, like if you have had a fall over the weekend or something new, come and tell me. You don't have to tell me in front of the group, but I kind of like to know what's going on anyway, just so I'm aware. But yeah, definitely, talk to your doctor if you feel like this might be a good class for you and you can get started. We've had a lot of people see this at their different primary care doctors, and so we've gotten some referrals from that. So yeah, so I mean, have you taken a few questions then, or?
We had
Yeah.
a couple about those.
Okay.
So let's see. I want to make sure we go through everything here. Big thing with the exercise programs too is, if you're in a class and you feel like it's too easy for you, definitely make sure that you're talking to, whoever your instructor is, or if you're in the Upright University class, talk to us and say, hey, I really feel like I need to be in a higher level. I think after the first of the year, we're maybe even starting a third level class.
Mhm.
So it'll be a little higher up. And so if you feel like you need to move up in that, we can do that. Or if you're in a group and you're like, this is something I'm not, able to do, maybe we need to bump you down a level. But if you're in the right level, you're able to kind of push yourself a little bit. Those kinds of things are going to help you to keep coming back and make sure that you keep working at it. These are a couple of other programs that you can do. Obviously, Upright U. There's also Parkinson's classes. So if you have Parkinson's, you can work with Susie Craig. She's amazing. She also teaches out here at the Rock Chalk class. Fit for Life is something that's available. And then yoga, Tai Chi, aquatic therapy, those are things that you can do we don't offer them here at the hospital, but those are things that you can do on your own. The yoga and Tai Chi, there's even like chair options available that you can do. There are gyms, there's some local places here in town that offer some, and then same with the aquatic therapy. Um, this is just a few of the uh, testing that you can, or some of the testing that you can do on your own. There's links here with each of these that you can click on and go to what each of these tests are. Basically, they're just ways to test what you're at right now and whether or not you're at a high risk for falls. So whether or not you can, stand up and then walk 3 meters and come back in a certain amount of time, that's the timed up and go. That's something that can kind of estimate whether or not you're going to be at a high risk for falls, how long it takes you to stand up and sit down 5 times. Those are things that you can test. So that's something that's available to you as well. But yeah, so that's all that. So yeah, any other questions? We are definitely here for it.
I just have a quick question, and I don't. I was just wondering, does one have to have a referral to get into Upright University, or do you just sign up? It's a class offered through the hospital.
It's kind of it is through the hospital because we work for the hospital. We rent this space, but it is a community class, and so you do not have to have a referral. Again, if you've had lots of falls, if you are, on oxygen, if you have had some cardiac issues, I would definitely, let your doctor know, hey, is this good for me? I would advise that, but no, there's no, you don't have to have a referral. Another thing that I know is kind of pertinent for the new year is you also do not have to belong to Rock Chalk Park. I know that there's going to be a charge, I
Right.
guess, starting January. You can do this class without being, you do not have to belong to Rock Chalk Park to do this class because we are kind of a separate, we rent the space from them, but, we do not, we pay the rent, but we don't have any kickback to them for the classes or anything. So if you want to take the class and you are not wanting to pay I think, what is it, like $10 a month? I think they're asking for seniors.
I know what it is yet.
Yeah, and it's kind of because right now our door opens up into the track, and so I always encourage people to go out and walk, if they want to before or after class. I don't know if that's going to be a thing after
That's
they
true.
start
I didn't
charging,
think
if
about
they're
that.
going to be more strict about it. But that is one thing that no, you don't have to have a doctor's referral, and you don't have to be, you know, you don't have to pay the monthly fee at Rock Chalk to be in this class.
Okay. There's a question here, which was mine as well. When are these classes? When do what time of day? What days? How often do you meet? How does
Right
it?
now right now we have one level one class that starts at 1:30 on Tuesdays and Thursdays. And then we have two level two classes, one at 2:30 and one at 3:30. Now this is the last session of the year. So we go right up till Christmas. And then we start the new session in January. Um, we, I don't have the exact schedule yet because they're adding a few more Parkinson's classes. And I know they would like to add a fourth Upright U class. So tentatively, we're going to have maybe two Upright U classes in the morning, like a what?
I think 9 and 10,
Yeah.
9 o'clock. So they'll go from 9 to 9:50, and then the other one will go 10 to 10:50.
Yeah, and then I will continue to teach two afternoon classes, most likely 2:30 and a 3:30 class on Tuesdays and Thursdays. So I think we're definitely set on Tuesdays and Thursdays. It's just a matter of what time those 4 classes will be, but most likely 2 in the morning and 2 in the afternoon.
Okay. And how long does the session run?
Oh, the 6 week six
Okay.
week sessions. Yeah, yeah.
And to sign up, one writes to or calls the hospital, and is that where
Yeah.
you register?
Here are some of the links there. That first one is the
Okay.
Upright You link. But if for some reason you don't have access to this, on the LMH Health website, you can go to lmh.org, and under the wellness classes, you can find Upright You. You can even just type Upright into the search bar and it'll take you right to it.
All right. And those would be good links if you could send them to me. I'd be happy to send them out to everybody that has signed up for this class today. That'd be helpful.
Absolutely. Absolutely. I'll
Do
get that
that.
to
That'd
you.
be really wonderful. And here's a
Yes.
quick question from a couple. If you are feeling lightheaded and you think you might faint or fall, is putting your head between your knees still a good practice? Good piece of advice?
Um, it's not always. I would definitely say sit down. If you need to, if you're feeling faint, if you're feeling lightheaded, sit down.
And maybe even lay down and get your feet up. That
Yeah.
would be better,
Yeah.
getting that blood back to your head, whether, because most likely, I mean, again, I don't know, it might be from blood pressure.
hmm
And if we have someone like that that gets the orthostatic hypotension, which means when they stand up, their blood pressure drops and they get dizzy, a lot of times it's just too much with gravity, everything is just shooting down. And so we get them back and then get that blood back up to their heart and their head, if that makes sense.
Yeah. If your face turns white, you're supposed to put your feet up. If your face is turning red, you're supposed to put your feet down and your head above your feet. So that's kind of how I remember it. But sometimes you can feel dizzy and lightheaded with everything rushing to your head too. So
Yeah.
it's not always,
Kind of depends on
one or
what
the
your
other.
dizziness is from. Yeah.
Yeah. It's hard to say, do that. I just always say, if you can lay down, or sit down. If you're standing up, sit back down.
Okay. Any other questions from anybody who's here today? Um, I gotta say, we were talking before we opened the class, and I don't know what happened to me, but suddenly balancing, trying to stand on one leg or the other for 30 seconds is really challenging.
Mhm.
I have to touch something, it's really a lot of work. And that's just what's for dinner, right? I mean,
Yeah.
Well,
I
keep
mean,
working at it, keep doing it every day. And, at least practicing it is going to help you to, prevent further weakness from coming on, and it can definitely help overall. But join Upright You.
Yeah.
Come
Yeah.
see us.
Could you maybe show us a couple of exercises? We have a couple of minutes left. Okay, well, here's a question. Someone commiserates. Balancing on one leg is hard. It really is.
Yes.
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 My hat is totally off to every ballerina in the world. I
Yes.
can't believe how they do that.
Yeah.
Right.
Okay,
Yeah.
and as someone asked, when will the classes open for enrollment? Sounds like you're coming to the end of a session, the holidays, so it'd probably be January.
Yeah. I would, and if I don't know what the best way to get a hold of you, because what we I think are planning to do is have like a open enrollment. And so, from a period of time, like a week or 10 days, I think we'll have like an open enrollment. Now we usually hold space for people that have already been in a class, so the I mean the so if it doesn't hurt to try. A lot of our classes are full, but we also have a lot of people that are snowbirds. I have several in each class that are, oh, I'm going to Florida until April, so there, I think there will be some space, and especially since we're opening up a 4th class. But I will, because again, this is new to me, and I think this enrollment part is new because Brett said I think we're doing it a different way just to make it fair so everyone has a chance to sign up. So However, we can get that information to you. I don't know if it's
I was gonna say I just got your email, so
okay.
we can send it to you as soon as we find out more information, hopefully in the
Wow,
next week or
that would
two.
be great. And then I can
Yeah.
share it with everybody along with all the links so that everybody will have, the full meal deal so they know how to get hold of you.
Yes.
Yeah.
Yeah, that'd be great. Any other questions from our wonderful group of people that are ready to stand tall and walk with purpose? I wonder if you could suggest, we have only a couple minutes left or some time, but could you suggest some things that we could be doing at home? A simple things that we could be doing at home to
You know,
make practice like standing up 5 times in a row and
the sit
practicing.
to stands, those are always good. Just sit to stands, practice a good sturdy chair. Those are always a good functional one to do. If you've got a countertop in your kitchen, just hold on to the countertop and bring up a leg. Just hold up your leg and see if you can maybe let go with one hand. And then maybe, and this is what I do in the class. We usually have some sort of support or chair in front of you. So I always say, hover, hover over that chair if you want to have it. I mean, that's so you can do that at home. You can have a chair in front of you, a countertop, just try to see if you can stand on one leg, then switch that leg. Then maybe even try some head turning, just kind of slowly turning your head left to right. See if you can manage your balance. The closer your feet are together, the harder it is. And so if you feel like, okay, I've got this, I'm standing with my feet shoulder width apart, try standing a little bit closer and then try some of those balance, the one leg, the head turning. Um, those are just some small ones to do that you can do at home.
Mhm.
Walking is another thing, staying active and walking. Even if it's just every commercial break, you get up and you walk into the kitchen and then go across the hall and, do that 2 or 3 times the whole time the commercials are on. Stay up, stay walking. And anything that you feel like is really difficult, just make sure that you've got something close by that you can hold on to or your walker in front of you if you have a walker, and make sure that, you're staying as safe as possible.
Mhm. And that's a good idea to do your exercising if you're watching television in the evening, to
Yes.
to get up and,
Mm-hmm.
move
Yeah.
something.
Yep. Yep. Motion is lotion, right?
That's
Movement
right,
is
right.
the
Movement
key
is
to
it.
everything. Exactly.
I
Staying
saw
upright.
yeah, I saw something once that said move anything you can, any way you can, for as long as you possibly can.
I love that. I
Yeah.
love that. We should get that on a
That's
poster.
exactly. Yeah, and that's
T-shirt.
why, yeah, it's
Yes.
that's why like I said, and Katie knows in therapy too, like we have silly things just to make it more interesting, whether it's, shooting, throwing things and they're all concerned. I said, I don't care how many you get in the, how many balls you get in the goal. Like
Right.
you're standing, you're moving, you're doing this, like that's what it's about. It's not about how perfect it is.
Yeah.
So
Take big steps. Walk with a wide base of support. Move your arms. Always, keep those things going. Staying really stiff and tight to your body and taking short little steps. It seems like you're being safer, but really it makes you a lot less safe. So, walking with a normal, as close to normal gait as possible, that can really help too. So,
Mhm. And
yeah.
the mention of pets underfoot. I have
Oh
a
my gosh.
I have a cat. He's a feral cat. I'm out in the country. And when I go outside, he just likes to do this dance in front of me and
Oh my
right
gosh.
in front of my legs. And I'm telling him, if I go down, it won't be pretty.
yeah.
And
Yes.
I,
Yes.
I just kind of move him along with my foot, but I think he's enjoying it. So I don't really want him to fall in love with my feet. But
Right.
do you
Yeah.
have any stories from people that you've worked with about how they've figured out to live safely with their pets literally underfoot?
I had a patient one time who it was if you needed when he came into the house, he had to have his wife put the dogs in another room and let him get to the couch and sit down. And then once he was seated, she would let the dogs come out because as soon as he got there, they knew that the dogs were going to come jumping on him and trying to greet him and say hello. So it was one of those things where it's like, let's put the dogs away first. You get safe and then let them come out. And then usually they would calm down a little bit so you'd be able to get up and walk. But what about you?
I've had people put bells on their cat or
Mm.
dog, just to kind of know where they are underfoot. But I've had dogs and cats my whole life, and I know kind of like some dogs are, and cats are impossible to train, right? But um, you just really need to be aware of your surroundings. So again, if it's a dog that can't control himself when you walk in the door and wants to jump on you and push you over, then I think that's a good, if you want to coexist with this dog in your life, you need to make sure you can do it in a safe way. And if it takes somebody putting that dog away until you're safely seated, then, because unfortunately we've had a lot of patients that have had to rehome animals, and I hate that, but sometimes, it's just not worth the risk. But there are ways, and I've had patients also have to give their dog to their kids or grandkids, and they just have to visit, it just, we try to coexist, try to find some safe ways to do it. Yeah.
And then, of course, the other thing, walking out on the ice to get the mail. Don't be doing that.
Have a neighbor do
somebody else
it.
Yes.
Have a neighbor do it. Yeah.
Yeah.
So I know my dad is 82. He lives alone in a house. I got him some spikes, for his shoes. So, ice is ice. There's just we could slip on ice, right? I mean,
Everybody slips on
it's impossible. So, I got him these little trackers for his boots, so they actually strap onto the bottom. I don't know if you've seen them, strap onto the bottom of his boot, and they're almost like claws. Like you definitely not want to walk on your wood floor with them, but they actually, he has those because a lot of times in Kansas, it's black ice, right? It gets warm in the afternoon, and then it melts, and then it freezes, and then you go out the next day and it's black, because it's a sheet of melted, what used to be water now is ice. So I have those for him. Another thing you can do is, walk like a penguin. If you think about how a penguin walks, it's very short steps, kind of, just short side to side, very careful. But again, with ice, it's a little bit like when you drive on ice, there's just nothing
Nothing.
that's gonna, so definitely if you have a neighbor you can delegate to get your mail on those days, I would definitely do it because it's really hard.
Yeah. If it can wait until the next day, wait till the next day.
Yeah.
There's a message here. The post office will deliver to your door if you are homebound or frail.
Oh, there
You
you
have to
go.
install an exterior box by your front door. And
Okay.
yeah, so that's good news. That's good information. My neighbor at the bottom of the hill is an amputee above the knee, so he has one
Okay.
leg. And he's never going to be wanting to walk down all the steps, walk across the highway to his mailbox. So he has that exact service. He has a mailbox right by the door, and the rural carrier pulls in his driveway, goes up all the steps, and puts the mail in his mailbox. So
That's nice.
That's
Yeah.
awesome.
Yeah.
yeah,
I'll
so
say
that's
on
good
that same
advice.
note,
Thank you. Yeah,
on the same note there, the trash company, the city will get your trash as well. So if you can't take trash cans out to the curb, they will come up and get your trash cans and take them down and empty them for you. So
okay.
trash, and I think recycling will do the same thing. So
I'm
you just have
wondering,
to,
go ahead. I'm sorry.
you just have to contact the city and let them know, and they can make that arrangement for you.
I've had someone speak to me in a retroactive event about learning how to fall.
Yeah.
And they were suggesting we have an event or have a class in falling because there's a way to fall that's safe. And I wonder if you could speak to that. Is there such a thing? Um, and if so, how do we learn it and where do we go to find out about it? I just wonder.
Individual, again, people have different issues with balance, and so, and Katie and I have taught people how to get up from the floor. We've done that, when we've worked on the fourth floor. I've done a little bit in the classes here. I've had a few people get on their knees. And then we practice getting, get that stronger leg up underneath you. But a lot of people can't get up unless they are holding on to something. So if they're on the ground, they're on the ground. I mean, uh, that's a good, I don't know, again, what do you think about that? Like
Yeah.
how to fall safely.
Safe ways to fall. It's hard too because some people, if they have, for example, a stroke and they have left-sided weakness, and their chances of falling towards that side are common. So it is easier to kind of say, this is one way that you can do that and try to do it safely. But it is hard to just kind of teach like a general class for everybody, because what's causing that fall? What is it that is, how are you falling? There are safe ways that you can make your surroundings safe, so that as you go to fall, it's a little bit easier on your body. But yeah, I would want to do a little bit
Yeah,
more research.
as far I guess one thing I can say is, and this is something my dad used to do. He used to walk with his hands in his pocket. Like even if it wasn't cold, he just has a habit of putting his hands in his jean pockets or his coat pocket. I don't recommend that, okay? When you walk, you should walk with your hands to your side. This helps your balance, it helps your reciprocal movement. If you fall and your hands are in your pocket, as I told my dad, you're going to fall and hit your head. There's a good chance you're going to hit your head. If you have your hands free, yeah, you may break a wrist, you may break a shoulder. You don't want to hit your head. That is
No.
not the place you want to hit. So, I mean, if I can say a good way to fall, not to say you want a broken hip or shoulder, but you don't want a head injury.
Yeah.
No, no. And and the same people put in the chat, Parks and Rec has had one of those classes in the past, how to safely fall.
Okay.
Yeah.
I'll look into that, and
Because
I
I've
would
taught
like
people
to
how to
know a
get
little
up
bit
off the
more.
floor,
Mhm.
but I've never, researched like the best way to fall.
Yeah. Yeah. I'm gonna do some research into it and see what they say. Then I'll
Okay.
be more educated on it next time.
Yeah.
Sorry, guys.
Yeah.
Well, thank you for all your information, and you have my address, so do
Yes.
send me those links, send me the information about the schedule, when and where, and a little information that I'll share with everybody who signed up for this class today, so they'll know when to get out there and sign up for the next class. Because it personally, I'm a guy that exercises, sings, writes, does anything if I have a class.
Oh, yeah.
I
Right.
have to have a
Yeah.
class. I will show up for a class. But if I want to do it on my own, not so much. So we would really appreciate, all of us, to know how we'd appreciate information on getting enrolled in your classes and getting started on taking better care of ourselves and uh, and moving more. So thank you so much. If there aren't any more questions, we're about to the last minute. And thank you very, very much for being with us. We appreciate your time and we appreciate that you started this class. Was this just your idea to come up with it? Here's some people
Got
clapping.
lucky. We
Yeah.
just got lucky.
Yeah.
Oh, well,
Uh,
it's just amazing. Thank you, because this is an
Yeah.
issue, big issue.
Yeah.
Absolutely.
Yeah.
Yeah, absolutely.
Thank
Yeah.
you so much for
Yes.
having us.
Yeah,
We
thank
appreciate
you.
your time.
Thanks for coming.
Yeah, thank you. They're great information, handshakes, flying hearts. It's lovely.
All
So
right.
thanks for helping us, and I look forward to getting information from you, and I will share it. Thanks for being
All
with us
right.
today. Everybody,
Thank
take
you.
care. Thank you. See you again.
I guess
Bye.